Green Space is the Green Social Prescribing Programme for Nottingham and Nottinghamshire. We're one of 7 test and learn sites across the country, and we're aiming to embed Green Social Prescribing into our local social prescribing system, making it an intervention of choice for our health professionals.
I first became aware of Green Social Prescribing quite early on in this current role. So we began sort of talking with the commissioners and the CVS around the bid for Green Social Prescribing. Our trust lead's been in post for a few months now. She started to make really good links in with green providers and started to do some awareness and information sessions about mental health and ensuring that providers can support people who we might refer. We'd like to have providers in place in all localities within Nottingham City and Nottinghamshire so that we can offer a pathway for patients in all areas.
And we've really tried to create a sort of a graded approach that actually if we know somebody's at a certain point in their own journey in terms of being acute, when they're in recovery or they're building their resilience and they're building their functioning, which group gauges them in green, nature. We embed Green Social Prescribing in referral pathways and in clinical care so that it's seen as a real treatment, real kind of recognition that actually this is going to be really beneficial for people's recovery.
You're doing something different every time you come. Conservation week, you'll be going on walks, boats, cycling. Being in nature, I think it takes a lot of stresses away. It makes me feel better in my mind. It stops you thinking about my PTSD. Been bought a companion dog and he's been brilliant, so take him for walks.
A lot of our activities have connections with voluntary opportunities. We're encouraging people when they're finished with us to move on to independence, to volunteer with the green spaces that we've taken them to.
We've also recently put on some Tai Chi and yoga activities in Green Space. Just seeing the impact of that on people's anxiety levels has been really amazing.
It's not just one person that you've affected, their entire family is affected, their neighbours are affected. People sort of start cooking and hand it out, or they sow some seeds and then they share them with their neighbours. And you can see this whole ripple effect going through.
So we very much bring those services to the hospital site really to say, even at the point of someone being acutely unwell or at that point of secondary care, that actually you can start that journey, and it kind of breaks down those barriers and that fear if they can meet somebody from those groups. And it helps us to promote to other staff as well that actually there's these brilliant community offers.
We do horticultural activities, but we also use it for sort of collaborative art projects, music, community events.
We'll be taking referrals from individuals who have early onset dementia.
It's about just being outdoors, enjoying each other's company, having conversations that people might ordinarily never have.
Through the garden, we are testing a 2-level community delivery model, a secondary care gateway to social provision, and a peer-led model connected to service provision and the social prescribing link worker network. We hope that the example of Highbury will inspire other hospitals across the county to do something similar.